Hi, I'm Dr. Noelle Cloven, a gynecologic oncologist with Texas Oncology and the co-chair for the Gynecologic Oncology Group Foundation Communications Committee. Today, I'm here with Dr. Linda Duska for the second installment of our Accrual Culture video series on top points for site selection. Today, we'll be focusing on feasibility. Thank you for being with us, Dr. Duska. Would you please introduce yourself?
Sure. I'm Dr. Linda Duska. I'm also a GYN oncologist, a clinical trialist, and I practice at the University of Virginia in Charlottesville, Virginia.
Thank you. We have a series of questions. Feel free to jump in with anything that you feel that you need to add. The first question, and we're focusing on feasibilities. You say that you love feasibilities. Not all of us love feasibilities.
No,
Sometimes we
no,
feel like it's a big chore. Um,
I don't love feasibility questionnaires. I don't love filling them out. But what I am passionate about is feasibility as a concept, right?
right.
So there's no point in opening a study that you can't accrue to. And that's what feasibility to me means. Is this study feasible to do at my site? And we can talk about what that means. But I think that's critical internally, even if you don't have to fill out even if there's no feasibility assessment to fill out, you need to assess that internally, right? So that you're not opening studies that use resources that you could use for other things that might be more successful. So that's why I'm passionate about feasibility, not
Yeah, that's a
passionate
good
about
point.
feasibility questionnaires.
Yeah, no, but that's true. I mean, as onerous as they can be, they're important. I mean, that's why that we have them is because we need to make sure that, we're opening studies that we can accrue to, that we can be successful at. And yeah, we have limited resources
Right.
now more than ever, and we can't afford to spend a lot of time, on things we're not going to be successful at. So let's start with the first question, and that is, who is responsible at your site for filling out the feasibility survey?
Okay, so let's go back to the overall feasibility question just for a minute, because
Okay.
even if I don't have a feasibility survey per se, my little research group does feasibility for every single study that comes through. And I'm going to talk about why that is when you ask me the next question. But even if it's an IIT that you bring to my group and say, I want to do this IIT, we're going to ask you to do a feasibility assessment, not a feasibility questionnaire.
Got
But,
it.
and this gets back to resources, like we were talking about before. But to answer your specific question, the feasibility questionnaire is filled out by my clinical research group, usually one of my clinical research coordinators. But even before we get to the questionnaire, we've already reviewed feasibility as a group and decided that we want to proceed with this study because it's feasible for our group to do. So before we even get to that step, we have reviewed internally the feasibility process. But specific to your question, usually one of my clinical research coordinators fills out the feasibility questionnaire after we've already gone through the internal feasibility assessment.
Okay, yeah, that sounds really like a good system. So they know. I feel like at so many sites, the research manager is just kind of left high and dry, and they're
Mhm.
responsible for filling out all these feasibilities, but they don't really have any feedback. So that leads to the next question, which I think you've already answered, and that was, is the PI involved? And I guess at your site, it sounds like not only the PI, but the sub-investigators and staff is involved in the feasibility process. So how do you have time to do that?
As a group, we meet once a month to go over feasibility, and we also have what we call a queue because at my cancer center, they'll only let me open 4 trials at a time. So
Oh,
we're very careful about how we structure the queue and what the queue looks like. So that's part of our feasibility assessment. And when we think about feasibility internally, we look at three different main categories. First of all, patients. Do we have the patients to put on this study? Because if we don't, there's no point in going forward. Secondly, competing trials. Do we have competing trials that are going to limit our ability to put patients on the one that we're reviewing, right? And also,
mm-hmm.
if I'm going to open a trial, I don't want to open a trial and put one or two people on. I want to open a trial and be the high accruer, right? Not that I'm competitive or anything.
Right, right.
But so I don't want to open too many competing trials, and I want to make sure that that doesn't happen. And for example, the topo ADCs come up as a great example of this. Once you've
Gotcha.
had a topo ADC, you can't go on another one. So, do I have competing trials? Do I have the patient population? And number three, and I've already alluded to this, do we have the resources? if I open this trial, can I assign a CRC to it?
Hmm.
Will, does my infusion unit have the resources? If I'm opening a complicated phase one, that's going to take up a lot of resources and time. Will that limit my ability to open other studies? So all of those things go into the calculation of feasibility for us internally. So
Yeah.
we go through all of that before we ever even move to the feasibility survey. Once you've gone through all that process, the feasibility survey is relatively easy. And also you're already at a place where you understand this is a study I can do. And the sponsors are going to be happy if you accrue. If I open a trial and I don't accrue because it was an unfeasible study, they're not going to choose me for another trial, right? So I have to make sure that I'm mindful of that. And I hopefully that answered your question.
No, it does. And I like your answer because I think so many of us, really, we just want to get picked for every trial, right? We think
Yes.
let's just open as many trials as possible, because, well, I mean, of course, you look at there's a lot of scientifically interesting trials out there. I mean, we have more trials than we've ever had, more options. So you're right about being selective and being honest and real. And, also I like that you're looking after your staff too, because, if they get overworked, no one's going to be happy. The other thing to think about is, are you get overwhelmed with data? Is there going to be too,
Yes.
if you
Oh my
open too many
God.
trials, then you've got all these data queries, and so you really do have to be selected. But
Well,
I,
to your point about data, I'm sure you're going to do a separate video on data, but to your point about data, there's no point. Well, one of the main points of doing clinical research is answering a question. And if you're
mhm,
not doing your data, you're not going to get the answer to the question, right? So everybody hates data, it's tedious. And at the same time, it's critical to the research process. And my team knows that. And they
right,
know how important data is, not just to check off a box and get it done, but more importantly, help us to get an answer to the question that we're trying to answer, right?
right, right. So I think, one of the questions is, this when we originally thought of this concept, this was when, we were almost fighting to get selected for trials. And so the
Mhm.
question was, what do you feel is most important about a feasibility survey and getting your site selected? So remember, the topic of this is site topics for
Yeah.
site selection. Now, we're in a little bit of a different situation where we have a lot of trials. We have, again, and we like to think of it as more trials, more opportunities. So this is a good time to build your portfolio. But I guess still, kind of thinking of it, let's say that, I mean, I know you're very selective at your site for trials, but let's say there is a trial you really want, and it's targeting an unmet need at your site, and it's scientifically interesting, and you want to be sure that you're selected, but it's highly competitive. What do you think would be important on this through this feasibility process on helping your site get selected?
Yeah, that's a really good question. I think we already touched on being honest. You don't
Hmm.
want to overpromise. In fact, I'm a huge proponent of underpromise and overdeliver because I think the sponsors really appreciate that when we do that.
Hmm.
Um, Also, I think, going after the big sexy study, that's great. And I do that all the time, and I'm a big proponent of that. And at the same time, um, if it's not feasible at my site to do it, it's not the right time to do it, and I shouldn't do it. But to answer your question about feasibility, I think choosing that big sexy study that fits your patient population will really help you. And then making sure that you're just honest about your ability to do tissue biopsies, pharmacodynamics, pharmacokinetics, whatever it is that the study requires, and focus on the requirements of the study, and highlight those abilities in your feasibility assessment.
Okay. Like it. So do you, at your site, do you keep metrics as far as numbers of patients seen, diversity, where that way it's easily accessible? So, because they do ask some pretty specific questions on those, on some, the feasibilities are getting longer. I mean, we're trying to kind of keep them down where they're manageable, but do you keep a metrics for that help you with numbers,
We
or do
do.
you just eyeball it?
No, we do. So to your point about the feasibility questionnaires taking time and being somewhat onerous, I think it's really important to be consistent from one to the other to the other. And so we do keep a list of the most commonly asked questions and the statistics that we share with sponsors. The other thing, when I fill out a feasibility questionnaire and they come in to do my PSV and they ask me the same questions over again,
Mhm.
I want to make sure that there's consistency. I know it drives me nuts. I want to make sure there's consistency between what I say in the PSV and what I said on the feasibility questionnaire.
Right.
Um, so, but getting back to your question, yes, we use our tumor registry. I'm very fortunate that I have a comprehensive cancer center that gives me access to the tumor registry. So I use my tumor registry for, how many endometrial cancer patients we see a
Mhm.
year, all of those kinds of questions. Um, Same for demographics, trying to be consistent and realistic about the demographics of my population with respect to race and ethnicity,
Mhm.
so that I can answer those questions. We all know the sponsors keep track of how many of those patients we accrue anyway,
Mhm.
but I have those numbers available to provide more complex questions like how many patients do you have that are HLA-A positive or something like
Right.
that. More obscure things. Sometimes I have to make an educated guess about those, like how many POLE positive patients do you
Right.
have? I don't know, but I would guess it's in the 5% range since that's what it is for so making educated guesses and being honest about that, I think, because many of us don't have access to that kind of
Yeah,
specific data.
it's hard. And I like what you said about just using kind of general population statistics. That's kind of what I do. And they say, what percent of your patients are MMR deficient? Well, I mean, it's probably the same as it is everywhere,
Right.
you know. I mean, sometimes the questions, one of the things I was going to ask you is, we always get these tough questions and we all kind of maybe roll our eyes when they say, how many platinum sensitive patient or how many recurrent platinum sensitive ovarian cancer patients do you have that have folate expression between 50 and 75% and you've had bevacizumab, and you're thinking, how would I, how would you
Yeah.
answer that question? But I guess you have to put something there. you
Yeah, I
know
mean,
I,
I think it's fair to say it's a guesstimate, right? I
yes.
mean, I give my best estimate. Like I know this is how many recurrent ovarian cancer patients I have. I know the minority of them are platinum sensitive. And
Right.
of those, I know about half of them, maybe I'm guessing. In our population, it's probably less than half would have high folate receptor alpha. I don't know
Right.
why, but in Central Virginia, it's lower. And give them my best estimate because there's no way you're going to be able to get those specific numbers. And I do think they know that. And
Yeah,
yet
they
they ask us
must.
questions anyway.
Yeah.
And then also, I strive for consistency. So it makes my staff's life easier if we're asked this question more than once, just to have this is what we said for this study. So let's be consistent. And also you don't have to reinvent the wheel. So we keep these as I said earlier, we keep these numbers um, in an Excel file somewhere so that we're
Mhm.
consistent with our feasibility questionnaires.
All right. Well, it sounds like you're very organized, and I really appreciate
Oh,
you being here with
no,
us today and answering some
not
of these questions and sharing your enthusiasm really about these surveys, and also reinforcing why they're so important, because they really are.
yeah.
Um, you
And
know,
just to repeat, I am not enthusiastic about surveys. So I am not. They're a process that we have to go through, right? But
right.
I am at the same time. I am very passionate about feasibility because I once had an investigator say to me, I opened this study for Alaskan natives in Central Virginia, and I was never able to accrue anyone. And why is the School of Medicine not helping me accrue? And I said, well, because we don't have these patients in Central
Yeah,
Virginia, right? So, had you thought about the feasibility of doing this before you opened the trial, you might not have opened the trial. And that's an extreme example. At the same time, I just feel like if you're very mindful of opening trials that you know you can accrue to and that don't compete with other trials that you have open, that is how you are successful. And that is how sponsors will come back to you and say, wow, you are a high accruer. We want you again. Right.
right.
So
Exactly.
the
You build a
overall
track record.
concept, yeah, the overall concept of feasibility is what I'm passionate about. The surveys are just part of the process that we all have to go through. And at the same time, if you've gone through the internal feasibility process already, it just makes the questionnaire a lot easier.
Exactly. Well, thank you so much. We really
Oh,
appreciate you
sure.
participating in our series.
I'm so
And
excited to participate in the series. Thank
well,
you.
awesome. Well, we'll be seeing you soon at the next meeting.
Yes, excited.